Thank you for joining this demo session. Today, I'm going to demonstrate two items from GoMart. The first item will be the blood pressure arm with the Omni 2 and the speaker, as we can see on the second screen. And the second item will be the smash training arm. Just to introduce myself before I start with the introduction and the demonstration. My name is Natalie. I'm from Simulid. I'm the sales manager for Levant Territories. I'm based in Lebanon. Before I move to the demonstration to see the hardware and the software of both the blood pressure arm and the smash training arm, I would like to briefly introduce a presentation for each and every product. So therefore, I will be doing an introduction to the blood pressure and then demonstration, and then I do a quick introduction to the smash, and then we do the demonstration. I will share my screen. Okay. So the first item I'm going to present is the item S415.100.250. This is the latest version of blood pressure arm with Omni 2. So as we can see here in the picture, this is the blood pressure arm. The set includes of the blood pressure, the full adult size blood pressure arm, along with the cuff, along with the stethoscope, using the real stethoscope and modified blood pressure cuff, with the tablet that is already installed, the Omni 2, which is the operating software, along with the speakers. So you have an option to buy it with or without speakers. Actually, you can use any speaker you have in your site. So it is not mandatory to get the speaker that comes with the package. So if you want to order it without speakers, it's 415.250. If you want to order it with speakers, it's 415.100.250. I just want to like familiarize or remind us everyone what the terminologies. So when we say what is the Korotkov sound, when we say Korotkov sound is the sound when we hear during taking the blood pressure of the patient. So it's normally 12/8 for normal people, if they don't have hypertension or hypotension. So it is the sound that we hear, and we hear the auscultation during when we start the audible sound that we hear when it's on the systolic, and the sound will disappear when we are on the diastolic. So this is the Korotkov sound. In the software, we have volumes for that Korotkov sound from 1 till 5. Okay, we will see how. And we have something called auscultation gap. It is also called silent gap. So what do we mean by auscultation gap? This mainly happens for hypertensive patients. It is the gap or the disappearance of the sound that, for some time between the systolic and diastolic. As you can see here in the graph, you have the systolic starts at, for example, in hypertensive patients, you have 19 like over 10, for example. So the systolic, we hear the audible sound at 19, and then there is a gap. We hear nothing. The sound disappears during this interval. It is not necessary to be from 16 till 17, but this happens for hypertensive patients. And once this sound disappears, we will hear the systolic sound till we reach the diastolic and it disappears. Okay, so just to recap, The auscultation gap is the Korotkov sound that disappears for some time between the systolic and diastolic. So this is everything concerning blood pressure as introduction to the product. Now we will move to see the product demonstration. I will share my screen for the presentation. Okay, so this is I'm using, as we have said on Monday, the Omni 2, the operating software, can be installed on any Android smartphone or tablet. Now I'm using a Samsung tablet, and you can also use it on any Android smartphone. So I have downloaded the Omni 2 app for free of charge. So I just click on it. It has several interfaces, so you can use it for blood pressure arm, for Noel birthing simulator, for CPR plus D, for blood pressure. Okay, I'm going to connect to the simulator. So as you can see above, you have the blood pressure arm. You have those green dots, the 5 green dots, which is that my controller is connected wirelessly, successfully connected, okay? And there's a wireless communication between the controller and the blood pressure arm. Okay, if you can see here the screen, so the set includes of these are the speakers come with the blood pressure arm. You have the modified blood pressure cuff. You have the real stethoscope. I don't have it now because I will not be able to use it since I will be the only one hearing the systolic and the diastolic. You have the power, and we can connect the speakers. So why to use speakers? If we are in a classroom and we're training for 30 students, so that 30 students will be able to hear the systolic and the diastolic audible sounds. Okay, so no need for each and every student to put the stethoscope on in order to check the systolic and diastolic pressure. Okay, here you see the Omni link. Okay, so here the Omni link. This is the device that makes a wireless communication between the controller and between the arm. Okay, so this is the setup. It's a plug and play setup. You just connect the speaker to the arm, and the arm to the power. Put the Omni link in the LAN, and put the modified cuff here. Okay, so we are ready to start. It is already connected, but how we connect? We press on the connect to the simulator. This is the serial number of the simulator, and we press on reconnect. It's disconnected, reconnecting, and now connected. Okay. So this is how we connect the simulator. Now, how we put the vitals. Here you see in the favorite, you have, or if I go first to the vitals, you have four parameters. You have the heart rate, you have the When I press the plus button, we can see that it will be eliminated from my favorites. Okay, if I don't want the heart rate to appear, or the auscultation gap, or the Korotkov sound, so I see in the favorite, I can see only the parameters for the blood pressure. Okay, but now I will add them both, everything, so that I can be able to use it. How we change the parameters? We just click on the heart rate, and I want to put it, for example, 90. Apply now. You will, I feel when I put it, I feel that the heart rate, when I count, it's 90 beats per minute. Okay, and when we change it to 75, if we count it, it will be 75. Now for the blood pressure arm, this is by default. When we launch the software, by default, we have 12/8. I will put it, for example, 14 or 13/8. Apply now. The auscultation gap, as I said, where the sound, the Korotkov sound, will disappear between the systolic and the diastolic. So it will disappear somewhere, according what parameter I put, from 13 to 8, which is the 13 systolic and the 8 diastolic. So I put on, it will disappear between 95 and 100. Left Korotkov sound, this is the volume of the sound. You have 1, 1, 2, 3, 4, 5. I will put 5. And now I'm ready to start assessing the patient or the students. Okay, I put all the parameters. I just select what I want, and I will let now my simulator is ready for the student to start their assessment. The third icon, you have the blood pressure sphygmomanometer. Okay, so as you can see, it's on 0. On my tablet, it's 0. The place where it's in the green zone, it is where I selected the blood pressure to be. It's 13/8. So I will hear the sound will start appearing, the audible sound, at 13 and will disappear at 8. And what will happen from 95 to 100? It will go silent. I will not hear any sound from 95 to 100, and it will continue till 80. Okay, so let us try. Okay. So if you can see the, sorry for the delay, you will not catch it, you will not see it in real time when I'm inflating my cuff in real time. You will see it on the monitor, but please apologize the delay that it's happening due to internet connection. So I have inflated my cuff, and I will deflate it. At 13/8, I will start, so I'm starting to deflating. And if you can see my screen, when it reaches 130, we will start hearing the systolic sound. So here, I started to hear the systolic sound. It stops from 95 to 100, and then it will continue to 8. I'm not sure if you have heard well. I said it is due to delay, but this is the whole concept of how we can assess the students and evaluate them if they heard the audible sounds well. Okay, so you put 13/8, you put 18/8, 10, for example, and you let your students to assess if they are hearing correctly the audible sounds. Okay, this is everything related to the blood pressure arm. Please let me know if you have any questions before we move to the SMASH training arm.
Thank you.
Okay. What about the others? It's okay. Shall I move to the SMASH?
Yes, clear. Thank you.
Okay, now the second item is the AS402.100, which is the SMASH training arm. What the SMASH refers to what? So what kind of skills can be done when we get the SMASH training arm? The S refers to the subcutaneous. Subcutaneous injection is the injection under the skin directly. The intramuscular is the injection in the muscles. The A refers to the arterial injection, where we inject the arteries, and you can do also a venous. So you can do both injections, the arterial and the venous. But here it is not mentioned because the V doesn't have any place here in the word SMASH. You have the suture. So those items, I will show it to you, which is the suture, and for hemodialysis. Okay. Hemodialysis, so this simulator, the target of this simulator is mainly the specialty nurses where they work in the hospital in hemodialysis department. Okay, it is the place where they do dialysis for the renal. The second slide, as I said, the subcutaneous injection site, this is the first picture. It is where we do injection directly under the beneath of the skin. The intramuscular injection site, where in the muscles. It is arterial and venous, as we can see here, the arterial blood sampling. So we can collect blood from the arteries. And we can do the IV exercise, the intravenous exercise in the dorsum of the hand. It is where the dorsum is where you have those veins in the dorsum part of the hand. And this is the hemodialysis exercises, okay? So where this is when the blood comes, when the blood goes through the machine, and it the machine will do a filtration to the blood, and then the good quality of the blood after filtration, it will come back to the patient. Okay, so this is the fistula that already we can change it, and this is the fistula where you have the blood coming out of the patient, doing the filtration, and then coming inside the patient. So this is the SMASH, refers to subcutaneous intramuscular injection, arterial, venous, and hemodialysis. Here you can see that we have a micro pump. As you can see, we can change the pulse rate, which is the heart rate, and the pulse strength. So therefore, you can just select the heart rate, the value that you want. There is a pump that will that you can feel the arterial pulses, so that you can inject for the ABGs, the arterial blood gas collection, and the pulse strength. You will feel when you palpate the arterial pulse strength. So this is everything for the SMASH. Any questions before I move to the product? Okay, apparently we don't have questions, so I will move to the SMASH training arm. I didn't fill in the blood because we are not on site to inject and to collect blood or to do the hemodialysis process. But just for you to know the package, it comes with the arm along with the holder, the bag where we fill in the simulated blood. It comes with a bottle of simulated blood, syringe kit in order to fill in the blood along with the tubes. Therefore, the blood will come inside the tubes and then goes for the arteries and the veins, and the revert will come from here using another tube. This is called the fistula. Fistula, this is a built-in device where during hemodialysis, the patient when they do hemodialysis, they do the built-in fistulas in order for not every time to inject the patient. So we will take the blood from the patient and put it as if on the machine in order to do the filtering, and then the clear or the clean blood without the potassium or the phosphorus, because this is mainly the thing happens in renal patients. It do the filtration, and then the blood will come inside the patient. It comes with 2 fistula items. It is plug and play as well, because you remove this one and you place the other. You have the fistula, you have the arterial, you have 2 arterial, 2 fistula, and 2 suture pads. And you have at this side, you have the intramuscular injection and the subcu. So those are the suturing where you can use it. You can just do it with blade incision, and you can suture the patient. So it's a multi-skills simulator. And here, as I said, the micro pump, where you have it's okay. Here it's the place where you put the simulator to the power, and you have the heart rate and the pulse strength. When you, as much as you maximize those strength, and you, after you fill in the blood, you will palpate the patient and you will feel the arterial pulses. This is everything for this SMASH. Any questions?
Sorry, Natalie, can we have some more details about the fistula and how we use it on the trainer itself? I mean, what can we do? And yeah, that's it, please.
Okay, as I said, the fistula, pretend that this is the skin of the patient, and under the skin you have this thing is called a fistula, where you have a built-in device in order to do every time, not to do the every time the punctures. Okay, so pretend that this is the fistula, and you inject the patient by taking out blood and put it, you can put the devices that you are using, you can use real devices for real cannulas, syringe, everything related to punctures, and you can, the blood will come through the veins. You will get the blood from the patient, so you can you put the syringe and you take the blood from the patient, go through the hemodialysis machine, and let's say it does filtration. You can pretend doing that you went to the hemodialysis, you put it, the simulator on hemodialysis machine, and then when the blood filters, it will come back. So you will see the blood coming in, out, and in. I hope I have answered to your question, Sharbil.
Yes, so this was my question actually. If we use real instruments and we actually connect it, can we actually connect it to the machine, or just the trainer is to how to, use the instruments on the hand.
Exactly. It's the skills that the nurses should require, how to prepare the patient. So you have to do the hygiene process to prepare the patient, and then how you inject the patient, how you connect it to the hemodialysis machine. In fact, you can connect it to the machine, but no one allows to do that because of hygiene process, because the blood that you are using is simulated, and it is not good for the blood from the machine to come through the simulator. So we just this is dedicated for the nurses, specialty nurses which work in the hemodialysis department, to do the trainings, the skills, to acquire the skills how to do how to approach the patient, how to do the hygiene, how to clean the patient in that place, and how to inject the patient, and how we connect it to the hemodialysis machine, and that rotation that the blood is coming out of the patient and then coming in. So they will learn the rotation, if you want. Okay, so they will acquire that kind of skills.
Excellent, thank you.
Welcome. Okay, any other questions? Okay, it seems we're good.
One more question.
Yeah.
You mentioned that it's also a simulator where we can do arterial blood sampling.
Exactly. It's
So
here.
is it what is called the ABG? So can we do these procedures here on the simulator?
Yes, you are right. So it's for the ABG refers to arterial blood gas sampling. So when we fill in the blood and we put the simulator into the power, on the power, and we select the heart rate and the pulse strength, we will palpate the arterial pressure, and we can inject the patient. So this process is called the arterial blood gas, can be done on this simulator. In addition to the arterial, it's venous as well. Okay, here you have veins on the dorsum. So this part is called dorsum. You have veins, 3 veins, as if in real patient. You can also puncture and inject, or even give medication. Okay, so you can take a sample of blood and you can give medication. So both works. This is for the IV. So you have 3 veins in the dorsum, and you can inject and take blood sampling from the patient as well. Okay, so venous, arterial.
Thank you.
Welcome. So here is the intramuscular part. So here we have the IV, 3 veins in the dorsum. Here the fistula, the ABG, the suture where you have 2. Those are consumables. On this side here, you have the intramuscular, I feel it. And on this side, you have the sub-Q. Okay, the sub-Q is when you inject under the skin directly, and you see a bump will appear when you do the injection. And this is built-in micro pump in order to give the arterial pressure.
Please, thank you very much.
Welcome. Any questions?
Great, thank you.
Okay, great. So thank you everyone for joining and your attention. So we're good to leave. Thank you.